Hi everyone, and welcome back to my channel. Today's a day in the life is going to be me going to the career fair. Y'all know I want to be in the medical field, so I'm gonna go see which role is right for me. What's in here? Oh,
Like my patient just kept.
PA. What's PA?
It's actually PA.
What's a PA?
PA is a physician assistant.
What is a physician assistant?
So a physician assistant is a vital part of the U.S. healthcare system. They recognize that the patient is the center of all healthcare decisions, and they partner with the patient to kind of define the patient's healthcare goals. So PAs can practice in any work setting and in all specialties, and their duties do depend on the work setting, the experience level, what specialty they decide to choose and practice in, and state laws. So a lot of the job functions of a PA will include taking medical history, performing physical exams, diagnosing and treating illnesses, ordering, interpreting tests, developing treatment plans, prescribing medications, and assisting in surgeries as well as performing procedures.
Wow, how did that start?
Yeah, so the PA profession was used to increase access to healthcare. The profession started when Dr. Eugene Stead developed the nation's first formal PA program at Duke University in 1965. The individuals that were selected for the program had already received medical training in the military. When he developed the curriculum at Duke, he used the fast-track physician training program that was being used for World War II. The first class ended up graduating in 1965, and then after that, many other programs were developed. All of the training programs that came from that were developed based on the Duke training model. Some of them were in North Carolina, we had some in Oklahoma, Yale, Emory, Johns Hopkins, and so many more. In 1968, Dr. Richard Smith developed the Medicine Extension Program, otherwise known as MEDICS. And this model was used to help meet the rural needs in the Pacific Northwest. And it was a pathway for veterans who had been medically trained to re-enter the civilian life as healthcare providers. Today, the PA profession is now about 60 years old.
Well, how do I know that PAs are qualified as health professionals?
So the PAEA, the Physician Assistant Education Association, made sure that new PA graduates are ready to deliver patient-centered care the moment that they graduate from school. And they do this by developing a few core competencies. The first one being patient-centered knowledge, meaning are you able to use current information from data and consider the patient's personal unique background to be able to make a personalized plan of treatment for that patient. And then the second one would be society and population health. Are you able to understand how your patients' lives are being affected outside of the clinic, and how can you tailor that to your decision of patient care? And the third one would be the health literacy and communication, and that's where are you able to communicate with the patient as a partner and collaborate in making a decision for their treatment plan.
And the fourth one is professional and legal aspects of healthcare, meaning that PAs are able to practice medicine in a beneficent manner, recognizing and adhering to standards of care while attuned to advancing social justice. This ensures equitable treatment and respects patients' rights, fostering healthy communities and advancing healthcare for all. The fifth one, healthcare finance systems, in which PAs are able to articulate the essential aspects of value-based healthcare and apply this understanding to the delivery of safety and quality care, meaning making decisions that optimize patient care outcomes while also considering the efficient use of resources. Next, cultural humility, meaning being open-minded, understanding, and being respectful of other people's cultural identities. And lastly, self-assessment and ongoing professional development, which means demonstrating awareness of their personal and professional limitations and develop plans and intervention for addressing gaps and ongoing continual process.
And here's more information about our profession.
Thank you. Wow, today I've learned so much about the PA profession. I'm glad I got to hear about the history. And one of the flyers they handed me even had some interesting statistics.
Let's go. Statistic, yep. Statistic, yep. Statistic, yep. Statistic, yep.
Since 1987, 20% of all PA students have been minorities, and as of 2022, 77.8% of students identified as women. That's awesome. In my home state of Texas, the salary for a PA ranges from $93,000 to $112,000, with a median salary of $101,000. And guess what? There could be 352 potentially accredited programs by 2027. So maybe y'all will see me as a new PA in the future. And remember to like and subscribe. I'll see y'all for more adventures.